Welcome to the demo of the Vision Healthcare Management System. To begin, we are going to log into the admin panel. This panel is intended for the higher organizational users in order to manage the data in the application. Here, the admin users will be able to view a list of all the patients in the system as displayed in this table. Additionally, they'll be able to view a list of all the staff members in the system as displayed in this table. For any particular patient or staff member, the admin will be able to edit that member's details as well as delete a particular member. For the dynamic data section, this contains a variety of data elements which get incorporated throughout the application. So these data elements will be populated in a drop-down box or suggested search. So for example, if we had to add a particular clinic location such as Maitland, and when we save it, its success feedback gets shown and you'll see it in the table. So now when we go to sedation clinics and we want to create a new clinic which gets used in the sedation clinic component, and we set the capacity, when we type Maitland, it will come up as a suggested search. We can save and then the clinic gets added. We can also view all the past clinics that have already been ended. The general practice component in the admin panel is there to manage the authorization constraints associated with the general practice. So here for each staff member, a variety of patients gets assigned, and that staff member will only be able to view and edit their assigned patients' details. So this is where the management of such takes place. Additionally, in the admin users will be able to register a staff member, and upon successive registration, an email will be sent to that particular staff member in order and prompting them to change their password. So now if we go and log into the normal general system, which is intended for all staff members or the general users, they'll also be able to see a list of all the patients in the system. Additionally, they'll be able to register a particular patient, and there is validation incorporated in every input in the system. So when we go to appointments in the sedation clinic, this is the clinic that we just created. And then for every clinic, you can schedule appointments. If we choose a particular patient, such as John, and we give a reason, example, then we can schedule an appointment for that particular clinic. For the clinics that are scheduled for the current date, such as Maitland, we'll be able to choose an appointment and we'll be able to check in a patient when ready. It will then automatically log the arrival time. Following this, we'll be able to start their visit. And when the visit is started, it should display in the dashboard under started visits. So this information is yet to be filled out throughout the patient's visits. So if we want to track their location, we can click current location, which would drive the user to their current location, which is the waiting for triage waiting list. So over here, the user will be able to capture the information relating to this phase. And when they are ready, they can then transfer the patient to the next stage, and so on and so on. They'll be able to capture the information relating to that particular phase, and then so on. The procedure information relates to the next phase, and then the disposition information relates to the next phase. So for the purposes of this demo, we'll then transfer the patient all the way to the exit phase, and when they are ready, they can then exit the system, and if you click hospital, you then can select the transfer hospital. And once saved, it should be displayed exited in the dashboard, and then the patient has exited the system and is done with the visit. Included in every table, there's a search option where we can search for a particular patient. And then for every patient, you'll be able to view their profile, which will show a list of all their past visits. And if you click on the past visits, it will show all the information relating to that specific visit, such as the times which were automatically captured, the screening information which was filled in, and all the other information which has already been captured. Cool, so that's the sedation clinic. We can now move on to the general practice, which is similar in nature, except it's a day-to-day practice. So therefore, the appointment management will be a daily calendar. So you'll be able to schedule a particular appointment for only the patients in which the signed-in user has access to, and then we can give a reason, and then we can create an appointment. And if the appointment is scheduled for today's date, you'll be able to start the visit, and you'll be able to then see that started visit in the dashboard. Then you can then capture the information relating to that patient for that particular visit, as similarly to the sedation clinic component. There's also voice to text incorporated in order to improve the efficiency. This is a test of voice to text as such. Additionally, the signed-in user will be able to view all their patients which are assigned to them, and then they'll be able to view that patient's profile and see all their past general practice visits, etc., etc. The application is also compatible with mobile devices as well as with tablet devices. Cool. Thank you for watching the demo. All right, bye.